Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies and otherwise medically complex patients, whilst providing quality care, and where we also provide tailor-made solutions for hospitals and intensive care units to save money and resources, whilst providing quality services. In last week's blog, I talked about, is it true that support workers can't handle safely ventilated patients with tracheostomies at home? You can check out last week's blog by clicking on the link below this video. In today's blog, I want to focus a little more on home TPN, or about TPN in general and how it can be applied in home care. So today's question is, what is the requirement for intensive care nursing staff at home for home TPN? So we are certainly learning with intensive care at home that there's an increased demand for patients or clients on home TPN or PN. Now, for those of you who haven't heard of TPN or PN, TPN stands for total parenteral nutrition, and it's basically intravenous nutrition, and it's often given for people with conditions such as gastroparesis or simply an inability to digest nutrition, gastric cancer, or they might have had a Whipple's procedure, or other conditions that lead to the inability to take in oral, PEG or nasogastric feeds, and they need then total parenteral nutrition or TPN. Now, PN stands for parenteral nutrition. The difference between TPN and PN is simply that if clients get TPN, it's their only form of nutrition, and when the reference is made to PN or parenteral nutrition, clients often have other forms of nutrition as well, like nasogastric feeds, PEG feeds, or sometimes even oral intake. So then the question is, can clients on TPN or PN go home? Yes, of course, absolutely. Think about it. If ventilated and tracheostomy patients can go home with intensive care at home services, then clients requiring TPN definitely can be handled at home as well. We have certainly looked after patients at home on TPN and PN, and the way to do this is basically by liaising with the hospitals to get those patients home as quickly as possible. We are liaising then with the gastroenterology team or with dietitians, nutritionists, etc. So what is actually needed to get a patient home on TPN or on PN? Well, the patients or the clients need a PICC line or a central line, which is a device that enables the clients to receive TPN or PN. They can't have it through a normal IV cannula. It needs to be given through a PICC line or a central line or a CVC catheter. And that is also why patients on home TPN or PN need intensive care nurses, because looking after a PICC line, a central line, as well as the TPN is a very specialized skill that usually only ICU nurses have or critical care nurses have, because to access a central line or a PICC line, to manage a PICC line and a central line, it needs to be done sterile, and certain techniques and skills need to be learned to manage that safely. Central lines, also known as CVCs or PICC lines, are rarely being used outside of intensive care units. Therefore, it is a skill that mainly, as I said, ICU or pediatric ICU nurses have. A central line or a CVC or a PICC needs to be flushed in a sterile way to keep the PICC line or the central line patent clean and free from line infection. Also, when TPN is being prepared and connected to the patient, again, that needs to be done in a sterile manner, and people that have worked in the intensive care unit have that specialist training and specialist skill. Next, when someone is on TPN through an infusion pump, the pump may alarm quite frequently, actually because TPN is actually known to have frequent air alarms. So even if there's only one micro bubble of air in the IV giving set, the infusion pump frequently alarms, and the ICU nurse needs to make sure that the infusion giving set is free of air, so that there is no air going into the patient's vein, of course, because that could be really detrimental for a patient's safety, could potentially cause air embolism. So therefore, for the period of time that a client is receiving home TPN, which is often up to 24 hours a day, an intensive care nurse needs to be present to manage the TPN at all times, manage the pump and manage any alarms that may come up. This is something that can't be done by even general nurses, or can't be done, or let alone by a support worker. Therefore, a service like intensive care at home is really the only specialized service that can provide the type of service in home, so that clients can leave hospital and not stay in intensive care or in a hospital for longer than necessary. It reduces the cost, of course. It frees up hospital ICU beds and other beds, and of course it improves the quality of life for clients and their families, because they can be at home, which is where they want to be. There's also an increased false risk when clients are on TPN or PN because of the attachment of the TPN and PN to the patient and to the infusion pump. And to the drip stand. This is cumbersome for mobile patients because the drip stand needs to be moved around as well, and it poses a false risk. So I hope that helps, and I hope that sheds more light on what needs to be done to get a patient home on home TPN. Now, if you have a loved one in intensive care and you want to go home with our service, Intensive Care at Home, and if you want to find out how to get funding for our service and how it all works, please contact us on one of the numbers on the top of the website, or send me an email to patrick@intensivecareathome.com. That's Patrick, just with a K at the end. Please also have a look at our case studies, because there we highlight more about what we can do for our clients, how clients can live at home with ventilation, tracheostomy, TPN, and you can also look at our case studies. And if you are at home already and you need support for your loved one at home, ventilation, again, tracheostomy, BiPAP, CPAP ventilation, TPN, and you have insufficient funding, please contact us. We can help you with all of that. We can help you with the advocacy. We've been there before. We've helped most of our clients to get the funding as well. And if you are an intensive care nurse or a pediatric intensive care nurse with a minimum of 2 years ICU or pediatric ICU experience, and you ideally have a critical care certificate or equivalent, please contact us as well. Check out our career section on our website. We are currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, northern suburbs, Mornington Peninsula, Frankston area, South Gippsland, as well as Wollongong in New South Wales. We are also an NDIS, TAC and DVA approved community service provider in Australia. Have a look at our range of full service provisions as well. We have also been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare companies. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll talk to you in a few days.